Hello, YouTube. My name is Mark. I am a 36-year-old active male as a hobbyist. I recently ruptured my Achilles tendon and had a lot of decisions to make as far as how I planned to treat it. As a profession, I am a pharmacist, a PharmD, so I have some good access to up-to-date studies and analysis and articles concerning the latest literature and whether that supports one therapy over another. And I am deciding to go the non-operative route and wanted to share my journey with you all on YouTube because I am here in the United States and it is currently a rare choice to make. Most physicians and surgeons and common knowledge would point you quickly into the direction of surgery, but there is other options, and there's some good research that indicates non-surgical intervention may provide a great outcome for someone who suffers a similar injury to me, a complete Achilles rupture. So my Achilles rupture was on December 10th at close to 11 p.m. playing in a men's soccer league. The classic was kind of backpedaling to receive a pass, opened my body up, and went to step back and accelerate with the ball. And I felt a snap and immediately fell down. Knew exactly what had happened the second it happened. Not any significant pain, just kind of felt weird. And my foot didn't work. So kind of knew right away an Achilles rupture had just occurred. So I made the decision to go to the ER. They put me in a cast. And then I had to follow up with an orthopedic surgeon at the ER physician's advice. They were both quick to recommend surgery as soon as possible. And then the orthopedic surgeon had his nurse put me in a walking boot and took me out of the temporary cast. And I mentioned those two things quickly because neither one put me in a really great position with my foot. The ER, I believe it was a paramedic who did this. She kind of put me, if you're normal, say here's your leg, your normal foot position at rest is kind of like this. She was kind of like here, not bad. The orthopedic surgeon's nurse put me definitely at neutral, and it really hurt. So I told her I couldn't tolerate it. So she gave me a tiny wedge to make it a little bit like this. And I think preferable would have been more like this at a plantar flexion angle to keep your tendons kind of squished together and not pulling apart. Since those two meetings, I've had a couple days off work and lots of time to really update my knowledge on the literature and the studies on what is effective to recover from this, really difficult injury. And I think a lot of it has to do with your timelines and your goals. For me, I'm active. I still work out. I like to sail. I like to ski and run. Lift weights. But I'm also not naive, so I know that those goals might have to be mitigated. I just want to come back as healthy as possible, um, in a somewhat reasonable time. So I can link some of these studies and journals and articles that I found down below for you to kind of look into. I also found some helpful groups online on Facebook, Achilles Rupture group, and AchillesBlog.com, where people kind of update everyone else on what they are doing and how they are progressing. And I will try to do a semi-regular update here as well. My injury is a pretty standard one. You can see I've got my sleeve on. There's my foot. And nice little gap right here at the weak spot of the Achilles. Uh, Clinical exam puts it at a 2 centimeter gap, and nothing too huge, pretty normal, middle of the road, 100% complete rupture that I experienced. Um, my age, being a 36-year-old active male, kind of a sweet spot of an Achilles injury. Playing some high intensity soccer that I probably should have calmed down a little bit first. I've been having some knee issues, so I haven't been doing as much leg work as I typically do. And I think that definitely contributed to the injury as well. So I hope this is useful for somebody out there. I know for me, I went scouring the Reddits and groups and YouTubes, looking for all the information I could, both based on studies in the medical field, on PubMed, on UpToDate, and also looking for individual stories, trying to find someone who's similar to me, and kind of looking for answers and how to best make the conclusion whether I'm going to go surgical, non-surgical. And for me, going non-surgical seemed to be the right way. It's a long road ahead. I can detail in another moment here why I chose non-surgery. But whether you choose surgery or not surgery, all told, you're looking at 2 to 3 months of pretty much being kind of useless with that foot. And then once you're over that hump, you've got that next 3 to 6 months. It's just about being smart and diligent and pushing it a little bit, but not too much, to kind of get it back to strength and health. And then between 6 and 12 months, you're almost back to normal. I mean, you're not going to be doing long jumps, as many as you can in a row or anything, but kind of building that strength up more and more, feeling more and more normal, until you kind of hit that 9 to 12 month window where you're pretty much as good as you're going to get. I mean, you could probably get increase somewhat after then, of course, until 2-3 years even down the line, but your trajectory of healing is definitely going to be that classic arc where it's going to, at the 9-month, kind of tail off, and you're really seeing small gains after that. Most of the reason I am deciding to go non-operative is there's some good evidence and studies out there that show whether you have surgery or not, you are going to be able to recover as long as you treat it well. There's some studies that show between surgery, like open procedure versus minimally invasive, and then the non-operative, there's immobilization versus kind of quickly getting back to life, but with intelligence, keeping your foot at certain angles and progressing at certain benchmarks. I'm going that last route. I am keeping my foot at a certain degree down, called plantar flexion, right around 30 degrees for a couple weeks. And I can list some protocols I'm going to be following, loosely, of course, based on feel, but definitely not trying to do too much too fast, and definitely not going to be stretching it past any neutral angles for quite some time. I want to keep it as tight and the tendon is short and healthy and close together as I can, because the tendon right now, here's a good, healthy, strong tendon. It's snapped, but tendons don't look like this. They look like this. So I'm trying to keep it like here, so that all the, the plasma and the hemoglobin and everything that goes on inside that sheath where the tendon resides is getting it as close together so that it can touch. And then hopefully over the course of my recovery, get back to a healthy tendon, as close as it can be, with some scar tissue that's going to be there. The studies showed, with pretty good evidence, that if you do this functional rehabilitation protocol quickly, that you can produce outcomes right on par with surgery without having to have surgery. And as far as me, I'm an anti-interventionalist as much as you can possibly be. I would think that surgery should be reserved for cases of clear and obvious benefit. And if you can produce an outcome that is right on par with surgery without having surgery, that should be the road you should take. So I'm taking it. I'm having a great physical therapist and a great podiatric surgeon going to follow me along and make sure I'm hitting my benchmarks as far as tendon reattachment, Thompson test becoming negative, and just function, progressing the right way. If I fall off and it's not healing the way I hope, which is unfortunately a possibility, of course, it's a possibility with surgery as well, then I may consider surgery down the line. I'm really hoping that's not the case. I have a good plan of attack I feel really confident in a good mental place, which helps. Um, and hopefully can heal up at a good steady rate. Um, it's nice having the surgeon be on board with me. He's really kind of interested to see how this turns out. In the United States now, it is really a standard of care, that Achilles rupture surgery. So this is kind of a case study that's in front of him. That I think he's interested in following too. Um, and I'm feel like a little bit like a guinea pig, but there's really good evidence in other countries, Canada, New Zealand, Denmark, Europe in general, that you can certainly heal well without surgery from an Achilles rupture. So I've got some good support for the decision. Um, you know, if I have to, this video is really just made to kind of chronicle the progression. I don't know how often I'll be updating, and I just hope it's useful for somebody out there, because I know, people posting their stories on these blogs and groups and YouTube were very helpful for me. And the more information that's out there, the better. It can't hurt. So I hope you guys enjoy the videos and learn some things. I'm just going to kind of detail in this one, why well, I'm not going to anymore. I've done detailing why I chose to go non-operative. The studies seem to support that it can be done, and I would much rather do it that way than with surgery. So with that said, I'm going to sign off, and I can link below this the studies that I talked about, the articles that I talked about that led me to this conclusion.